Welcome everybody. It's August and September already, and this is the CEO Message, and I'm Nicki Herriot, the CEO of PHN. I'm really excited that Compass is coming up. It will be on the 13th to 15th of October. For those of you who don't know, Compass is our annual teaching and learning conference, and once again we collaborate with NTGPE in bringing this to you. This year we've made a really big effort to make it an event that's going to be enjoyable and really worthwhile and educational across a range of streams. So this year we've really focused our theme, and it is holistic care across the lifespan. We've taken a lot of care in making sure that the CPD elements will have something that's really important and interesting for you if you're a professional as a GP, or a pharmacist, or a nurse, or an Aboriginal health worker. If you're a practice manager or a practice nurse, there'll be something for you there as well. Our sessions will include cultural workshops with a focus on cross-cultural communication in the Aboriginal and Torres Strait Islander context, sessions around pharmacists and multidisciplinary teams, health reform and innovation, and palliative care, and discussing the importance of dying on country and how health professionals can support people's choices. Our plenary speakers are really wonderful people this year. We've got Billawarra Lee, an elder of the Larrakia Nation of Darwin, Charlie King, OAM, who most of us definitely know, an Indigenous Australia's sports commentator and award-winning anti-family violence campaigner, and Professor Catherine Stoddart, the new CEO of the NT Department of Health. Make sure you go to the website and read up about the program, and don't forget to register. I'll see you there. I'm really excited about the news about our consultations with the Catherine community in regards to Headspace. We've had some community sessions which have been really well attended. We've had numbers of community members come along, as well as providers, and then we followed that up with some specific sessions which we partnered with the Headspace National Office to have conversations with potential providers. One of the other great things was the opportunity to have a conversation with the young people in Catherine, which we held at the high school, and get their thoughts about what would make Headspace a really effective model in the Catherine region. One of PHN's key priorities has been to extend alcohol and other drug services in their regions. We've been very successful in commissioning services in both Darwin and Alice Springs, and on the 29th of September we proudly launched those services. These providers who we've been able to commission our services through are the Salvation Army and CAPS and Amity in the Darwin region, and DASA in the Alice Springs region. Those services are really holistic in the way they wrap around people at various stages of their treatment. We're making great progress with the suicide prevention trial activities that we're undertaking in the NT. The NT PHN is funded to undertake a suicide prevention trial focused on Indigenous people in the Darwin region. We've had 2 meetings of the steering committee for the suicide prevention trial, and this group is quite a large group of local stakeholders, and they come together to oversight progress for the trial. In addition, we've got a smaller group comprising local community members that is focusing on the real working group activity to make the trial come to fruition. I'm really pleased to say that we popped back into Catherine recently on the 8th and 9th of September to hold our pop-up PHN. We do these events on a quarterly basis around the NT in collaboration with NTGPE. We had quite a lot of attendances as well at our CPD, and with a range of people coming along, professionals such as GPs, allied health and pharmacists. I think this is a great way for us to get out and understand what's happening in the local communities, and we intend to continue these through this coming year as well. Thanks for listening, and I'll talk to you again next month. I'm off to Compass soon, so let's catch up when we're there.